Good evening and welcome to another episode of the Mental Wellness Show, where we are changing the notion and the general perception of what mental health is about. We've introduced you to mental health and we've also promoted it to you, why you should know about it. Today, we are coming to look at the personnel in the mental health field. But before that, my name is Najamule Mensah Oakley, and this is the Mental Wellness Show. I would go for a quick commercial break. When we come back, I would introduce my guest to you. Stay tuned. Welcome back once again to the Mental Wellness Show on LATV, where we are bridging the gap between the professionals and the public, at the same time changing the notion that you have on what mental health is about. As I said, my name is Najamule Mensah Oakley, and today my guest is Mr. Edwin Boakye Yiadom, a clinical psychologist at the Korle Bu Teaching Hospital. Today, you would be educated on the various personnel within the mental health field. So stay tuned. But before that, do not be educated alone. Inform someone, call someone, and also join us via our Facebook handle, LATV Ghana. If you missed last week's episode, please do subscribe to our YouTube channel, The Mental Wellness Show on YouTube. Subscribe, and then you will get all the previous episodes. Good evening, Doc.
Good evening.
Okay, so we've introduced mental health to the public. We've promoted it as well, because I realized that we have a certain perception on what mental health is about. And so even if we have issues that we need to seek help, we don't do that because of the perception, okay, the societal stigmatization and all that. Aside that, I also noticed that we don't know where to seek the help from.
Right.
So we would like for you to introduce us to the team that comprise of the mental health personnel, what each of them do, so that we would know, and then how to seek them out for help.
Right. Thank you very much. And in fact, to you and your team for the good work done. We would all be happy to help others reduce the stigma. And I always say that one of the reasons why there is stigma is lack of knowledge. When people don't know, or when people are less educated about some things, they tend to stigmatize the situation, especially for fear of contacting it or whatever, like when the COVID came.
Yeah.
There was so much stigma, and that was simply because there was a lack of education. When the education kept coming, the stigma reduced. And so well done for what you are doing. Yes, when we talk about mental health, we all know that mental health is as important as physical health. In fact, they are in synergy. They augment one another. Our mental health affects our physical health affects our mental health. Okay. So let's look at it this way. When you go to the hospital, you say you are sick and you are going to the hospital, you realize that there are so many physical conditions and there are so many specialties within the fraternity of physical ailments. So we have doctors, generally we say doctors, and then nurses. But then when you go, we have nurses who have specialized in, say, oncology care, as well as doctors who have specialized in oncology care. The same goes with dental care and a variety of the conditions. And that's the same with mental health. In fact, we don't just have, when we hear of mental health, like you say, the stigma goes like, hey, so he's going to the mental hospital, then he's crazy and all of that. And so it's almost, I'm a psychologist, so for me, it's even better when it comes to stigma, even with us, the professionals, our colleague psychiatrists, the moment people hear of a psychiatrist, hey, and that is because it's all about why am I crazy and all of that. But within the fraternity, there are so many different professionals. We have the psychiatrist. The psychiatrist is a medical doctor who is trained to pay attention to our mental health, and they use medication to treat.
Okay.
Then comes in the psychologist, who uses what we call talk therapy. So psychologists, especially in our jurisdiction here in Ghana, are not prescribers. So no psychologist will tell you or will write a medication for you.
Oh, okay.
When it comes to medication, that is the prerogative of the psychiatrist, dealing with such similar conditions. We add what we call talk therapy. All we do is to engage our clients. We don't even call them patients, we call them clients.
Okay.
That's a high level of respect we give to our people. So we call anyone who has any form of mental health issue and needs to see a psychiatrist, a psychologist. We also have explained the psychologist. And when you come to even psychology alone, there are so many branches within psychology.
Wow.
And we will come back to all of them the same way with psychiatrists. And then we have psychiatry nurses. We have nurses who are also trained and specialized in mental health care. We also have counselors of varied angles.
Okay.
We have school counselors, we even have school psychologists as well.
Okay.
We have when you go to, in fact, generally, even community, in our communities, we have people who have specialized in community mental health care.
Okay.
So remember, I've mentioned the doctor trained to do mental health care. I've talked about the nurse trained to do mental health care. I've talked about the psychologist trained to do mental health care. I've talked about the counselor trained to do mental health care. Now let's pick them one after the other. When you go to a psychiatrist,
Okay.
when the patient is a child, you go to see a child psychiatrist.
But
Uh-huh.
I do the same thing.
Great.
Because
So we do the same thing. We specialize. Specialize means that as we go, we narrow our path
okay.
to go into various angles and spend all our expertise there.
Okay.
So now when it comes to, say, a child psychiatrist, a psychiatrist trained to attend to a child would have done that over a period of time that another psychiatrist attending to adults would want to concentrate on adults, and then the child psychiatrist want to concentrate on the child.
Okay.
It doesn't mean they cannot see the others, but they have focused their attention and their expertise, training, and number of years venturing into those angles. Now, when you come to, say, a school psychologist, it's a psychologist who has focused their training on helping to understanding and helping the school child.
Okay.
Right? So, yes, we also have child psychologists who also sees the child who, for example, child clinical psychologist or clinical child psychologist will be a child psychologist placed in the hospital to attend to children whose mental health issues have blown into illnesses or disorders.
Okay.
Right?
Yeah.
The same with community mental health nurses. They go to the communities when others are in the hospital. They are in the communities reaching out to people who have mental health issues. They go to them. If there is a need for medication, they administer whatever care that a nurse trained in the field of psychiatry does. That's what they do in the community, not necessarily coming to sit only in the hospitals. You know, when we talk about mental health, everybody thinks of curative. By curative, I mean, oh, someone has a problem, let's take them to the hospital.
Yes.
And so we are all looking at the hospital. It goes way beyond that.
Okay.
Way beyond that. So in the schools, we go there. In the communities, we go there. You name it. We will have a mental health professional in these various angles or these various areas.
So, Doc, I would say that if a psychiatrist is trained to prescribe medication, okay, why can a psychiatric nurse also prescribe medication?
Right. So basically, our field is such that we are trained to be prescribers and non-prescribers. Okay. like I said, a psychologist will not be a prescriber. So if I see you and I do my assessment and I realize that you would benefit from medication, what I do then is refer to a psychiatrist, right? Okay. Now it is this person who also do the assessment and validate whether you would need medication and what medication you would need. Okay. Now to augment that, whilst you are taking medication, I'm also doing my talk therapy. And so there are jurisdictions where I'm not too sure whether nurses are prescribers, okay, but I know that psychiatrists are prescribers. Okay. So to the best of my knowledge, the psychiatrist is the prescriber. That means that even where there is no psychiatrist, the psychiatric nurse would always make contact with the psychiatrist as to what medication must be given and all of that. Yeah. So even when we have people who are not prescribers, they liaise with prescribers, they refer and all of that. So there is always a holistic care, which is really available. Unlike what others think that these are not available, they are really readily available in Ghana.
Okay, so if you just join us, this is still the Mental Wellness Show. My guest today is Mr. Edwin Boakye Yadom, a clinical psychologist at the Korle Bu Teaching Hospital. And today we are introducing you to the mental health personnel. Doug has made us aware that there are various branches in the mental health discipline. He's talked us through the psychiatrist, what they do, what a psychologist does, what a clinical psychologist or clinical psychiatric nurse does. So we'll delve into details since his field is in the psychologist field, not a psychiatrist. So we'll delve more into his field so that he will educate us more. So don't change the channel, okay? And then don't get up, please. If you want to drink water, just inform someone to bring it to you so that we'll all learn and then bridge the gap, change the notion on what mental health is about. Doc, let's go to your field. Okay, right. A psychologist. Mm-hmm. Where do we find a psychologist? Because okay, if I have a problem and I feel that, no, I need someone to talk to, do I just go to the hospital and ask, please, this is what I'm feeling, so I need help? Or are there specific places that we can find a psychologist?
Right, great question. So what it is, I mean, today is better than yesterday. Mm-hmm. Currently, we have more trained psychologists than we did in time past. Even though, of course, the burden, what we will call the patient professional burden, is wide. Okay. But we still have relatively more. So I always look at the positive. We have more than we used to have in the past. Okay. Even before I address where to go when you need a psychologist, I want us to know that we are not interested in only curing, the curative. We are also interested in promotive mental health, like what you are doing. You are helping promote mental health, which is very good. What I'm doing right now, I'm also doing the advocacy, which is very good. Okay. Then in the various areas, we are playing World Cup. I am almost sure that every team went with their sports psychologists. Okay. So we have sports psychologists whose focus is in performance and all the things necessary for performance or hindrances like anxiety, social anxiety, and what have you. So they focus on the sports personnel, help them to master their game and be better at what they are doing within the heat of the moment, like what is happening at the moment. Yes. Now, apart from that, we have social psychologists, we have industrial and organizational psychologists, we have clinical psychologists. I mean, when you talk about psychology, it's almost as if because when you're not well, you go to the hospital. So it's like, it's a clinical psychologist we know, but no, we have a lot. We have health psychologists, we have community psychologists, like I mentioned, we have school psychologists, we have counseling psychologists. In fact, we have when you go to the court or when you go to the prisons, we have psychologists whose focus is on crime and criminology. Okay. So everywhere you go, like MTN, there are psychologists.
Okay, but Doc, before you tell me how to get in contact with you, what is the difference between a counselor and a psychologist? Because it seems as if it's the same thing.
Right. Well, I think that should be for another day. And then, of course, we are one similarity. We are mental health professionals.
Okay.
Yes, and then two is the branches. So for psychologists, we deal with assessments and treatments.
Okay.
Right. For counselors, they help you deal with daily problematic areas and how you can handle them. Now, like I said, there are a lot of similarities and lots of fine differences which we focus on. The important thing is a good psychologist, a good counselor, we know our barriers and areas to refer. So no matter which mental health professional you find yourself with, they would know the right personnel to refer if it is not within their scope. And so you ask the question, when you are not well, when you need to speak to someone, what do you do? What is important is for us to understand that speaking to people about our problems is difficult.
Yes.
It's very hard for people to come out because of trust issues, because of stigma, and sometimes because of even the people themselves not having the right vocabulary to express what they are feeling or what their emotions are. Yes. Right? And so it is okay to find the next person who is a mental health professional, or get in touch with someone who can help you locate a mental health professional. That is the beginning.
Okay.
It is so close to finding the right person to speak with the moment you get to locate a mental health professional. However, like you said, we are in the hospitals. Various hospitals have psychologists, and in fact, the Ghana Psychology Council and all the stakeholders involved are doing their best to get more in the system. And I would say this, that of course, stakeholders like private facilities, like private hospitals, should make sure these people are available, because wherever you find yourself, people may need to talk, people may need to express their issues. And so, for example, there are instances where someone comes with physical illness in the general hospital setting, and then after assessment you realize that the problem is, or the foundation of the issue is psychogenic, or is in the mind. In that case, a referral is made to the psychologist in the facility. And so whenever you want to talk, whenever you are not well, it is okay to go to the facility, the hospital, seek for help, as in locate, ask to speak with a psychologist, ask to speak with a counselor, ask to speak with a mental health professional.
Okay, so Doc, we would go for a quick break. When we come back, I would like you to explain to us what self-help is in mental health care. So please do stay tuned, and then we'll go for a quick commercial break. When we come back, we will continue with our discussion. Welcome back to the Mental Wellness Show, where we are bridging the gap between the professionals and the public, where we are changing the notion, the perception of the general public on what mental health is about. My name is Naja Mule Mensah Oakley, and my costume is assembled by Enos Fashion. She's located at La Green Court. So do get in touch for all your clothing for every occasion that you have. My guest today is Dr. Edwin Boakye-Yiadom, a clinical psychologist at the Korle Bu Teaching Hospital. Today, we are introducing you to the mental health personnel, the team that makes the mental health field. We've discussed the various fields of the personnel, and now we are coming to know what self-help is about. When we talk about self-help in mental health, what it is about, what you should know, how you should identify various signs and symptoms for you to seek timely intervention. Look, you've introduced us to the personnel. Now, self-help. Is there a self-help in mental health? There
is self-help everywhere. What I mean by that is, whatever thing you do to help yourself
Okay.
is self-help. And so if you're hungry and you get food to eat, you have helped your system to stay alive and healthy.
Okay.
Right? If your mental health is in a place where it's different from where it used to be, and you help yourself to bring it back to the stable place it was, you have helped yourself.
Okay.
And so self-help in mental health is very important. It must be encouraged. Okay, so self-help, what must you do? What is important is that you should understand yourself, your body. Okay, because whatever goes on in your mind, there are some manifestations in your physical activity, right? Okay. So take for example, say you are languishing, as in you used to be vibrant, and for a period like a week, 2, you seem to be a little inactive, a little not too there. You know, you're not in your elements as you used to be. You're not yourself. The things you used to enjoy, you're no longer enjoying it. The people you used to love to relate with, you are becoming a little bit withdrawn. Sometimes you can't even explain it. You are feeling sad for no apparent reason, or even if there is a reason, it looks like the level of your sadness has gone beyond where it should have been, or what it should be. You should know that definitely things are not going very well. It's just like you see something, you see food you want to eat, but you're full. Yes. But then when you're hungry and there is no food, you seek for food. The same way, helping yourself means that it's just like first aid.
Okay.
Okay, so giving yourself the mental first aid, that is what we call self-help when it comes to mental health. Self-help can be done alone, and it can also be done in groups. And so we have groups, self-help groups. Okay. Okay. Example is Alcoholics in Recovery, where they join, say, Alcoholics Anonymous groups. What they are doing is they are providing self-help in groups. So that is there. You have some of the things you can do to help yourself. Generally, in most of the cases, especially with mood issues, activities like exercises help. Activities like making sure you get your good amount of vitamin D in the sun helps. Activities like calling a friend and talking about some things help. Activities, depending on whatever the issue is, activities like talking about it, activities like even being kind to someone. Like you step out, you're not in your elements, and then there's an old lady crossing the road with some baggages. Sometimes by the time you help the old lady cross by carrying their luggage, you feel a little relieved, and it takes you to a certain level. What happens is that you introduce what we call the feel-good hormones into your system, which also helps fight, example, depressed mood and all of that. So self-help is very, very important.
Okay. So let's say I'm going through a certain situation, okay, and I want to help myself. Would it be difficult for me to do that? Because let's say, let's take a financial crisis, for example. I realized that I woke up this morning and I don't even have what to buy pure water with. Okay, and I am thinking, I've called those that I know can be of help and all that, and still the help is not coming. What do I do? How can I care for myself in that situation? Because you realize that when the situation is dire, then you lose all hope. You don't know where to turn to. In that kind of situation, a self-care difficult.
Right. Now, when we talk about the ease of it, I would always go like it's not easy. Okay. There are some things that are simple but not easy.
Okay.
Right. They are difficult to do, but they are the same things that must be done. They are very, very simple modalities to deal with them. Now let's take this money issue.
Yeah.
I mean, lack of money we all know what it can cause to everybody. It can affect your mental health drastically.
Okay.
Let's look at it this way. I don't have money. I am worried about it. And till from morning to evening, I keep worrying. It doesn't bring the money back.
Yes.
Okay? What it does is introduce more worry to you. Meaning, as you worry, you get anxious, you can get depressed, you can get stressed, and all of that. Okay? Now, that the money or the lack of it didn't bring, but the interpretation of the lack of it by you is what is bringing that. So self-care then means in your mind, protect your mind from the dire consequences of not having the money by appreciating the fact that there is nothing that is permanent.
Okay.
The reason you don't have money today is because you had money and you spent it. So at some point you had some money. Now, if you would focus on the negative, it will make you resign to fate and do nothing about it. If you focus on what you are able to do, you may be able to make the efforts, right? Example, I don't have money. I'll call a friend. My credit will get finished. My legs are there. I will walk. I will go out there and seek other ways of getting the means to feed myself. The question then is, would it come immediately? No. The difficulty is when we think everything we want will come immediately.
Okay.
And so expectations help promote the dangers of the troubles we are going through. And so, for example, say couples, one of the reasons why couples would have a lot of problems at home is expectations. I expect that you will do this. You expect that I will do this. We don't tell ourselves these. And so when I do otherwise, you get overly offended, angry, what have you, because you expected that I should have known and done this. Meanwhile, if you had communicated it, it would have solved the problem before the problem even existed. So the same way, one of the things that we can use to help ourselves is to communicate well to others and to our own selves.
Okay, so does expectations lead to mental health issues?
Expectations hurt.
They hurt.
Mm-hmm. And when you are hurt, it's your feeling that is hurt.
Okay.
And when we talk about feelings, we're talking about emotions. We're talking about one aspect of our mind. We have our thought patterns, which is situated in our belief systems. We have our emotions, or the way we feel when some situations happen to us. And then the third angle is the way we behave when we are feeling a certain way and we are thinking in a certain pattern. And so definitely it's related to the feeling. So yes, it affects our mental health.
Okay. Mm-hmm. So any final words on it? Right.
So we're talking about professionals.
Yes.
It's fair for me to say seek professional help early. Because one thing that we have realized is early detection of almost every issue is resolvable.
Okay.
It's easy, even with cancers. Early detection of cancer is highly treatable. Okay. So seek professional help whenever there is a need, and never for once think that seeking help is a sign of weakness. It's rather the opposite. Seeking help is a great sign of strength. Be strong. Let me be strong, and we can help our mental health. Thank you.
Thank you very much, Doc, for making time out of your busy schedule to have this discussion with us. Well, you've heard it all. Seeking help is not a sign of weakness. It just means you are human. We all need help at one point in time. Once again, this is the Mental Wellness Show. If you miss any episode, please do subscribe to our YouTube channel, The Mental Wellness Show on YouTube. And then you would be educated on the episodes that you missed. My name once again is Najamule Mensah Oakley. Thank you for making time to to spend with us and educate ourselves, change the notion and bridge the gap between professionals and the public. See you same time next week. I'd say bye-bye. Do enjoy the rest of our program.